So welcome. I'm glad to be here today to give this year's State of the College address. Uh, I will start off as I usually do by saying we're in a strong spot, and I will also acknowledge it's been a rough and mixed year. So as I go through, I'll highlight the peaks and valleys both, so we can re-experience the trauma and also enjoy the potential. So as I get going, I wanted to leave this land acknowledgement up for everybody for a minute for you to read. I'll remind you, this is actually penned by one of our alums who's a member of the Kentucky Indigenous Peoples. And you may know this state transported away the vast majority of their indigenous people. So you can imagine what her remaining here was like for her family, and use that as part of forming your thanks for the space that we're sharing historically. And I think the biggest feeling I had as I was starting to think about putting this together really was a sense of gratitude for the amazing quality, quantity, and rigor of the work that everyone in this audience and everyone in the college brings to what we do here. So I just wanted to start by thanking you for all that work, and this slightly modified quotation from one of my favorites, Theodore Roosevelt, just modernized to bring it into gender neutral for today's world. But the work itself may not feel like a reward, but doing it brings to the community the collective reward of everything we put in. We wouldn't be able to do it without each and every one of you. And I think I certainly, and I believe all of us, are grateful to one another for what we bring together. And that's part of why we do such a good job of holding one another up on rough days and thanking one another on good days. So thank you for that. One of our highlights, again this year, we have maintained our position as a number 6 school in the US News and World Reports ranking. We can debate the validity of the assessment, and I'd be happy to do that ad nauseum in another venue. But our students and their parents look at these numbers quite strongly when they're making decisions about where to go. We stay very firmly in the top 10, and really the variation between these 10 schools is pretty minor. So it's an achievement we should be proud of, that all the other schools still believe we're in the top 10 and that we have been able to put the work together to do that. And you'll notice going along, we've left strategic plan goals in the upper corner of these slides, just to give you some sense of how we're doing matching goals going through. I won't call all of those out. So our strategic plan focused really on our traditional education, research, and practice pillars, added a pillar of community as the foundational underpinning for whatever we do, and contemplated service in all of these arenas as an important component of our work. I have introduced twice in faculty meetings and started to speak in the college in general about the board mandates for the university to orient more strongly to the needs of the Commonwealth, and particularly to training people for the jobs that we have available here, making them agile and able to have a successful lifetime career within the Commonwealth, and making sure that what we do exports locally to engender local business, to ensure that things are available and working well for people in the Commonwealth. And I just wanted to reemphasize what I said the last time I talked about this in a faculty meeting, that we had already aligned very well with those goals with our strategic plan. And so as I start to call more on us to deliberately address what is coming from the board, you're going to see in the majority of cases that it's going to be minimal adjustments to what we had already collectively agreed to do in this 5-year period. And I think we will continue to do. But this is just a reminder that that push is coming not only from the university strategy level, but from the state legislature and the governing board as well. With the attendant politics that I encourage you all to participate in fully. And other than that, I will leave that topic alone until questions. Another real win for us this year, our accreditation was extended for the maximal 8-year period with 20 fully compliant standards and 5 standards compliant with monitoring. So specifically, thank you for all the work that went into the self-report and the site visit and getting ready for that, as well as all the underlying work that enabled us to put together that really strong presentation for the accreditors. This is a great win. The monitoring that we have to do, I think, is in all the areas we were already well aware of and we're already working on. So there were no surprises in this, and it's an achievement for the school that we made this. And I hope you won't take this the wrong way, but probably I will not be in this role the next time that we go through accreditation, as I'll remind you, the end of my second term is a couple years before the next roll through. So someone else hopefully will get to oversee that. But I'm very happy during my time as a dean to have had us come through this well. The credit is all to you, not to me, but it definitely made my life a happy day when I got that news. A valley for us this year, for the first time that we're aware of, our NAPLEX score rate, first pass rate, dropped below the national average down to about 75%. We're typically in the mid 90s, plus or minus 4%. So this is a real drop for us. We've already had started to address this. We had a little hint of lower scores the year before. We had responded to that curricularly. So things like reincorporating the top 300 drugs, building in RX files. We have, since this result, made collegiate-wide access available for 3rd and 4th year students to RX prep so that they're able to study with materials that are oriented directly to the NAPLEX exam. And we've constituted an internal committee to really take a look at what underpinning causal factors we could identify so that we could address those through whatever seems like the most appropriate response. My gut reaction is that's probably going to be some level of curricular revision along with probably targeted interventions. I have met with the chair of that committee fairly recently and will tell you, as we did when we roll this out, there's not really any clear single causal reason. So we're, I think, really going to have to work on a variety of factors to try to tune and make sure that this doesn't happen again. And as I said then, I feel personally we have a social contract with every student we enroll to ensure that they graduate ready to pass the national boards. And while I also deeply believe we should be teaching as we are towards the top of the license and towards producing leaders in the field, this is the other end of what we got to do, is making sure when they walk out the door, they walk out truly practice ready, including passing their boards on the first pass. So, I think given what we've gone through, we're going to have to see how this next year goes. We really don't know if this was a cohort effect, if it was a real trend, but we're going to have to treat it like it was a real trend and make the appropriate revisions going forward. And everyone has dug into this wholeheartedly, I won't say happily, but with an open mind and really putting a lot of work into doing it. So I'm confident we will get this fixed. I want to talk a little bit about enrollment. Thanks to the end of the legislative season, we have one more year at least where we can target enhanced diversity in a fully inclusive class openly. And that's something we've been working on for a few years. As most of you know, we've had an enrollment dip the last couple of years, the last year hitting about 100 enrolled in the last class. So I'm happy to say right now, we actually look like we have bottomed that out. And at least this year we are heading back up. I'm hoping that the offers that are out there will be taken and that we will wind up in almost as good as we were 2 years ago, which it will not be our aspirational 130 to 140, but it'll be a lot healthier than under 100. So this looks like the things we've been doing to target recruitment more, the scholarship work we've been putting in, the dollars we've been putting into that, all of that has been working, and your involvement in the recruitment process and in reaching out as faculty and staff to the students to ask them to come to us also has been working. And happily, we've been doing this while maintaining the quality of the students, at least with all the measures that we use for admissions. So certainly looking at those measures will be part of what we're doing, considering the NAPLEX scores. But from everything that we understand in the way that we're enrolling students right now, quality is being maintained and we're pushing the numbers back up. So a call out to the enrollment management team for getting this turned. And hopefully we will be able to bring it back up to our normal enrollment over the next couple of years. We will be talking about some other initiatives over the next year as we start to continue to broaden where we're going and focus how we're recruiting students. And then I wanted to talk a little bit about the bachelor's program. We've brought this up the last couple of times. So thanks to a lot of work, Eric, are you in the audience? From Eric and everybody who's worked with Eric, we now have the syllabi together. They're into Curriculog for the program application going to the Senate. It has now been broadly endorsed by other colleges within the university. We believe that we have an endorsement letter from anyone who might at any level politically object to the program. So going into the Senate, we should have short-circuited any of those kinds of issues, including all of the individual departments where we might be viewed as potentially competitive. Due to a lot of positive work from you guys, Renee and Eric, we have deconflicted the class schedule to the level that we're actually ready to deliver it in the class space we have available. We will be continuing to do some more work in that area. So we may be knocking on your door once more because we would like to be able to be as flexible as possible with that class space as we deepen the collaboration with A&S. Being able to share rooms when we're not using them is a really nice lever for us politically with them. If you don't know this, the White Classroom building, which they use quite heavily to deliver their classwork, is going to be out of service for 2 years. So they're quite stressed on class space. But overall, everything we needed to get done at those levels logistically has been finished. And we're anticipating this going off to the Senate shortly for approval. Assuming that whatever happens in terms of reorganization of the Senate does not get in the way, this should be approved for matriculating students in the fall of 2025. So I met with the provost yesterday for our annual budget meeting. And one of the things we did there was present 3 financial models for this program. So we've now modeled it out at a minimal running level of 40 students per class. And the level we had all been working with, which was growing up to 100 to 140 per class, and then the maximum that we could afford to support. So 2 things I'll pass on to you, but we will distribute that model more widely. But the first thing to know is the program is fiscally viable and supportable, even at 40 students a year. It just will bring in fewer extra staff and faculty, but it would still generate positive revenue for the college and allow faculty hires rolling out over time. At the maximal level, which is probably more than we are really going to want to do, it would generate quite a bit of revenue, enough to fully offset class size reduction in the PharmD class. So having that range to work with really is going to be great for us. Now, I bring this up because what you're going to see us put forward in the Senate approval and to CPE will be the minimal package. We don't want to over promise. So we're going to put through the minimal supportable package, but we're all shooting for the midpoint as we start to really roll this out. So depending on how big we build this and how quickly we build it, this program will finance between 7 and 15 new FTEs in the college, spread across staff and faculty. So, some of those are going to hit 5, 6, 7 years from now, but that will provide a revenue flow that's going to enable that. And that's not counting the extra revenue that's generated once we get to the end of the build out period. So it should also bring in money that can be used for things like scholarship support, for PharmD students, for operating expenses, and so on. So this is really looking, I would say, more fiscally viable than we thought when we started to build it out. And I hope that will help to motivate you, in addition to the cultural benefit of having some younger people who are quite a bit more intellectually diverse in the building with us that will come from teaching undergraduates. And both of these will help you dig in and do the work we're going to have to do to actually start delivering this. And before I worry you too much, I'll remind you, for most of you, you won't have to actually teach anything until 2027 or so. Will be when our heavy load will pick up, because most of the first 2 years will come out of A&S. And just to give you an idea about how this would roll out, this is the midpoint hiring plan for new people coming into the college that would be here. And again, this won't affect anything else in any other area. We're fully funding the startup from our funds. And about 5 years in, this will be generating a positive cash flow for us. All right, talk a little bit about research. So one of the things we had pointed out in the strategic plan is something that we wanted to do more of was to converge practice-based and basic research and clinic all together over time. So to cross the gaps between outcomes and laboratory, between laboratory and clinic, to start to do that work. And we're starting to see those trajectories really develop in a couple of places. So I just wanted to highlight one line through one of these trajectories, work out of Trish's group that was originated in the HEAL program that generated a fairly high profile paper looking at prescription and relationships between opioid prescriptions and drug poisoning deaths, then leading to an individual investigator grant within the college. So from a large collective effort through scholarship to an individual effort, right, continuing to build that cycle up. So we've got several other of these. I just picked this one as a single example to give you an idea that that strategy is working, and we're starting to really develop integrated programs that are crossing over those boundaries across what I would call work complexity areas, and pull together work and people in the college in ways that we haven't had before. So if you're in one of the 3 or 4 that I didn't mention, my apologies for not mentioning it due to the time, but I would just want to say, everybody, that we are starting to see the back end return of bringing extra money into the college to support this work foundationally. And I really want to encourage you to continue to utilize the pilot support we've got available to build these programs together, to run them through, and then to make them fully sustainable. I expect these kind of things will last decades once we get them out into funding. So this is a win for us. We've kept up our publication and our grant funding records. I think, as you know, John and I have been, as we've gone through a wave of retirements, coincident with a wave of new hires, our individual investigator grant money has been going down the last couple of years. This is something we were expecting, because as we're bringing in people who are establishing their careers, they're not coming in with 3 or 4 grants that are already in place. And we're starting to see those numbers go back up again. So I think, again, strategically that is working. And the great young people who we brought into the college are starting to build up portfolios, and that will continue to build our research funding and our scholarship records. And I hope what we will see is coming out of this place 10 years from now will be some really impactful translational work that started because we collectively decided to invest in growth of junior investigators simultaneously with building a system that supported team science and translational work. And we're fairly unique in pushing both of those strategies together and really trying to pull the whole community into them. So I believe we're seeing the early days of both of those really start to grow. And I'm looking forward to watching the growth of this over the next couple of years. And I know we all complain about the VPR's office and useless metrics and digital measures and all that stuff, but I did want to point out one of the things that came down from them was they invested in this Elsevier index. And so we learned that we had 8 people in the college who were in the top 2% of the world's most cited researchers. So congratulations to all of you who are on this list. I expect there are at least another 10 or 20 in the room and on Zoom who probably will be on this list in the next decade or so. So although I also expect some of us on this list will be firmly retired by that point. So it'll be a trade-off, but this is a good win. And I think it says something that we carry this much weight in a proportionally pretty small faculty in the university. So congratulations on that, collectively and individually. And then we were running a little heavy on slides. So I've condensed what is actually my personal favorite part of this, which is taking a moment to pick my favorite papers of the year, which has nothing to do with their impact factor or anything else, just the ones that I enjoyed the most. So Jeff, we really have to get rid of curricular load. And I love the way you said that in public. And I just went to a site visit where people were talking about this paper and telling me how they couldn't do that because everything was absolutely essential in the curriculum. But maybe the next time we think about our curriculum, we will be able to simplify it a little bit and go down. And Chuck, I wanted to say I never thought I was going to see a positive CNS use for a nanomaterial, especially with the papers that came out of atherosclerosis and plastic microparticles this year. But you did it, so that was a real win and an enjoyable read. And then I'd already called out this paper from Trish, but I'll just call it out again. I think really trying to dial past the rhetoric of substance use diseases towards how to do harm reduction is one of the most impactful things we can do. And if we don't do that in an objective, data-driven way, we wind up listening to a bunch of people arguing about it on a Senate floor, which does nobody any good. So these were the things I enjoyed this year. Keep coming up with enjoyable titles that'll get me to read your papers. Maybe you'll be on the list next year. All right, a little bit on the practice side. So one of the things that surprised me when we did our strategic plan was actually how heavy we wound up on practice goals, because they were actually interwoven in our scholarship goals and our research goals as well. It was not a bad surprise. I was quite happy that we wound up there. And this year we actually had to pare down the practice wins side. So it's been fun to watch all this start to really build up and go. So a couple of things I want to call out on the advocacy side. I think the win on getting vaccinations down to 5 years of age as a PEDS-oriented person, thank you for that. I hope we're going to get that down to birth, but I also recognize that's a hard sell. So that was a big win. Our investment, continued investment in the practical side of bringing real practice advancement out to the community setting by enabling medical revenue billing is important. Passing the law is one thing. So that was done a couple of years ago. Then there's all the barriers, the non-legal barriers to actually being able to do the work. We're still working on credentialing in this example, but we're getting closer and closer and closer to a pharmacist in whatever setting being able to actually bill for and get paid for doing something that falls into those categories. And then there's the business model side of it. If you can't work that into your workflow in a way where you can make it compensate well enough to make it worth it for your business, it's not going to matter if you can legally do it or practically do it. You're not going to do it. So, I think we chose to make an investment there, which we're starting to see play out as well, where we're helping people figure out how to make this work wherever they're working, whether it's a clinic, a community clinic, a home independent, whatever they're setting. And we'll continue to do that there, two different pieces of advocacy. Part of that is making sure all of our graduates are able to do that work, right? If you graduate now, we teach you how to do diagnosis, we teach you how to do vaccinations, we teach you how to do procedural care in our labs, in our experiential portions of our curriculum. If you graduated with a bachelor's degree in 1990, you didn't learn any of that. And so, we need to provide continuing education that is broader and deeper than what I refer to as a rubber chicken dinner CE event. It's not just a talk at a meeting, it's a hands-on, right, practically oriented, useful, more in-depth session. So we're retooling towards what we're calling continuing professional development, a broader mandate to provide whatever education is needed for pharmacists to be able to act under their license at any level, regardless of their educational background, regardless of their age, and regardless of their practice setting. So we'll see that going forward. And as part of that investment, we've still continued to work with Flip the Pharmacy, working on enabling everybody to transform practice to the levels that they want to be able to do that. So, I think the vision is any pharmacist as a business owner or an employee is able to work in their setting and make a positive decision about where they want to be. That's what drives their practice. Not a legal barrier, not a financial barrier, not a logistical barrier. And we, as a college, want to support that for every one of our graduates' life. So a couple other things on the practice-based side. I wanted to highlight the Protects initiative, which initially developed as a community pharmacy-based COVID testing initiative back in the early part of the COVID epidemic, and has broadened to allow both blood and nasal sampling for a wide variety of uses, and really is envisioned as a community research hub based in community pharmacies to allow reaching out to that level of population study through our network of practitioners. And this has continued to grow and achieve funding and is moving along. So I wanted to pull that up, as well as the continuing the work that started under HEAL of a broad and intensive substance use disorder outreach program that spans from outcomes work all the way to practical intervention. And I'd still like a implementation scientist in this area. So next time we do a hire, if you know anybody doing that, can you please get them into our faculty pools? Now, one piece of this I really wanted to highlight, I think most of you are familiar with the CEC Center at Norton in Louisville, which has been a really successful part of our college. We typically have 20 to 25 students who complete all of their APPEs coordinated out of this center in Louisville. It allows a regional approach for them. It's been good for the students in the sense that if they're a Louisville native, they can go back there to establish a practice network. If they want to move to Louisville, they have opportunity to do that. And it's also helped with our recruitment from people from that area because they can see that opportunity to spend their last year not in Lexington, but in Louisville. So with the merger of King's Daughters into the UK system, we had an opportunity late last year to establish a similar center in Ashland at King's Daughters, which we have now brought to fruition. And we're expecting to hire a center director for this roughly July of this year. So as early as next year, we'll be ready to start actually shoe leather on the ground in Ashland, doing the same work there as we have done before. And I hope we'll see all the benefits that we saw from the Norton Center, much tighter connection to the hospitalist pharmacy community in that area, the ability to reach out to the community pharmacists in that area, a tighter recruitment funnel for students from that area, and the ability really to work to ensure that there's a full range of experiential training available over in the heart of Appalachia, which is an area we have not touched as well as we should have. So all those are positives on our side, but we also know from Norton that this is likely to help King's Daughters up their own practice game, build a residency program, enable a higher level pharmacy practice within the hospital. So it's a win-win for both institutions. This will be building over the next year or so, and we're looking pretty hard now strategically at this as a way to come at other regional areas where we want to be more competitive. So I would encourage all of you, especially those of you who are practitioners, to think about places like Northern Kentucky and Bowling Green and E-Town and Paducah, where we might be able to craft similar opportunities and feed that back to us so we can be thinking about the potential to continue to build on this model, which has been really solid for us educationally and in terms of recruitment. That FTE is fully funded through King's Daughters, just like the Norton FTE. So it's bringing in another faculty member to our community as a benefit as well. Okay, just want to talk a little bit about some service work as well. We've been re-engaged in trying to develop more ground level interactions with the legislature. As our pharmacist colleagues have retired, we want to make sure we cement up those connections. I'm hoping we can get back to doing this with the UK board as we have in the past as well. So I think we're thinking about trying to connect to the community at that level, make sure we're in front of the decision makers every opportunity we get and that they can move forward. I'm going to be laughing about that all afternoon, Trinika. Proving your worth yet again. So just to look at the community overall. So we're for those of you who've been worried about faculty numbers, we're actually one over the number of faculty we had in-house when I started. So we have fully recovered from where we were down during COVID. And I think we're also almost spent out of our bolus of leftover salary money due to all the retirements and everybody else. So we're back to a retirement replacement kind of scope in terms of new hires. But as I was explaining, as the bachelor's program rolls up, hopefully we'll be able to bump the academy up a little bit. Staff has stayed pretty stable. I think as we go through centralization in research, we're going to lose roughly one FTE across several people and readjust there. I'm not going to be real surprised if we wind up centralizing a few other areas. So we'll keep people in the loop as this stuff goes through. But I think in terms of sort of quantitative numbers of people, generally speaking, we've got everybody on board. We need to do the work we need to do. And we're staying very attuned to that as we add work or adjust workflow. So one of the reasons I bring this up every year is, again, to say, if you're in an area where you feel like you don't have somebody you need, then let us know and we will try to fix that, or at least explain why we can't if we can't. Due to the alumni outreach efforts the last few years, we now know we've got almost 7,000 living alumni, a good number of whom we're in touch with. And our preceptor list is still well north of 600. So huge community, spread very broadly, interacting with the college in all kinds of different ways. Couple new additions. So Ashlyn and Kristen sitting right next to one another conveniently, and Kevin in the back. Welcome, guys. It's good to have you on board. A couple of us transitioning the other way. And you sure you don't want to do one more year? It'd be an even 50. So Ken, Bob, Joe, and Karen all moving on to greener pastures in this year. Each will be missed. Um, I would say each of you is a cultural icon in the college. So not only will we miss the work you do and your smiling faces, but the way you've nudged each of us to be better at what we do. We'll all have to spread that load out a little bit as you guys move on to doing other things. And thanks for all of your service. It's pretty remarkable to me to be an organization where I put this slide up and the shortest tenure is 30 years. That is, it really says something about this place that people stay that long. So that's a testament to the culture here. And we have a few people who have joined us for 2 weeks for our first faculty exchange program. So Christopher, Denise, Jasmine, and Vicky, welcome to UK for your 2 weeks here. We're glad to have you here. We're glad to learn a little bit about what you do, where you are, and hope you'll learn a little bit from us. And I hope we will be continuing this program. So I hope we will get a little more of our faculty willing to take 2 weeks and go somewhere else next year. And I'm looking at all of you right now. So I think it will be good for all of us to get out of Lexington and see what's going on other places. And we fully funded opportunity available for you to do that. We will swing back by and talk about dates and timing and so on to make sure that it's congruent with times of the year that people are comfortable with. But I hope this has been going well for everybody, and welcome to everyone who's joined us for this program. So as I said, about 7,000 living alumni. Some years I feel like I've met every one of these in a cocktail party at one point, but that's probably not true. It's probably only been Mike Burleson and 3 other people. 50 states plus Puerto Rico. 51 states and territories. I don't think we have anybody from Guam. 16 countries. As far as we know, 70 or so CEOs, company founders, presidents. I think that's probably actually an underestimate because we're depending on self-reporting for that. And 12 currently serving deans, vice presidents, or provosts in our alumni. So that's a remarkable number, especially when you consider that essentially all of them went up through pharmacy schools. And so a really pretty narrow academic community, although the provosts obviously are now working at a broader level than pharmacy only. So again, really a testament to the historical achievements here. And I think we are still doing this, developing leaders at this level for every field that we touch. Please join us for HODA, where we will be recognizing 3 of our alumni. Carol Gallagher, a quite high achieving biopharmaceutical entrepreneur, multiple companies and venture capital firms. Sam Poliak, who's the dean down at UT Austin right now, and Danielle Griggs, CPO at UVA Health. And our 5 distinguished preceptors: Autry here at UK, Shelley Roberts at Grassroots, Karen Itzel at Ephraim McDowell, William Reeser at Robley Rex, and Kelly Carrick at Whitaker. All right, to wrap up, I just wanted to talk a little bit about finances and budget. So, as you know, one of my goals when I came in was to get us to a zero sum annual budget process. So we were not dependent on reserves for existence. We told you last year that we had made that, and we are now running basically at zero sum plus or minus about $100,000. So within 0.2% of our annual operating budget, which I'm quite happy with. To give you an idea, I'm trying still to find an easy graphic for everybody to get all this data into one slide. This shows you inputs on the left, education, research, and philanthropy driven money coming in, and where we spend that money going out, which is dominantly research, secondarily education. That is mostly in the PharmD program now, then the PhD program, some still in the residency program, and right now a very small amount on the bachelor's program. That will be growing as we go into the next couple of years. And then the leftovers into infrastructure. Another way to think about this is where do we put that money in terms of disposition of the resources, and well over half of it goes into into support of faculty and staff in the college and trainees. So that's our biggest operating cost by far. We like it that way. We deliberately tune the budget really to support the people, because my viewpoint is you are the most important resource that we have. You're more important than the building or the equipment or anything else. So that's where we want our money going, the remainder going into operating expenses. And again, this is now pretty well balanced. We've got an annual budgeting process that's letting you at your unit level have input into what's needed, and we're able to hold that pretty close to the amount of cash we're bringing in for the following year. So the last bit of this is please speak up during that process. If you need something, we need to know about it. If you feel like we're spending something in your area we don't need to spend, we need to know about that too, because we can always put that money into somewhere else. And so, please stay actively involved in the budgeting, and then stay actively involved in the assessment side of how things are working so that we can tune this organically through the year like we do now. I was just yesterday moving more money into scholarships for Jason to be able to nail down those last couple of students. So we're able to do that because we have an agile budget now. And John tells me we're actually running a little bit in the black. So this year, you're going to tell me not to say that. Even better, we're running more than a tiny bit into the black. It's just this much. It's enough for a cup of coffee, but we are running in the black. And I just wanted to end with Rosa jokingly, I don't know if you were joking, told me I need to tell everybody why I travel so much. So we're gearing up for the next development campaign for the college. And we're now pretty nailed down on what we want to focus on. So I wanted to bring this up because one of the things I'm intending to do is ask for a lot of faculty engagement. I'm already doing this with some of you in these efforts. It's probably not going to surprise any of you to know that our major fiscal weakness is the relationship between our PharmD tuition and the market cost of a PharmD. So we're one of the most expensive degrees in the country for comparator institutions, and we lose students because of the finances. So we want to really shore that piece up by raising as much as we can for scholarships for PharmD students that are less limited in their distribution. So we can use them when we need to, where we need to in order to submit recruitment. So the idea we're having here is we're actually going to build regional funds for each area in Kentucky and some of the outlying areas where we generally recruit, and go to the alumni in those areas to fill in those funds in order to be able to build up, what at least on paper will be some full scholarships targeted to Northern Kentucky or Western Kentucky. In reality, we'll probably break those up into smaller chunks to support more students, but that'll be the major goal. The second goal is to continue what I've described before as our cushion, which is we try to keep our entire staffing on recurring state funding. So we want to be able to build that cushion even bigger by supplementing that with endowed professorships, which allow us to redivert that money at zero risk while somebody is on one of those professorships and have some extra cushion to work with on salary money. So that'll be the next goal. And then we're tooling up again. What I would like to do is endow the graduate program the way that the graduate program at UCSF is endowed, so that we can pay for students, ideally up for 4 years of full support for each student walking in the door, so that we're not dependent on grant support for those students in order to pay for their stipend and tuition. Now, I'm going to tell you right now, that's a long-term goal because that's a $40 to $100 million endowment to fund a good sized program at that level. But we're putting this as our first big dollar goal to see if we can get a naming gift, something like that aimed at that, and a raise goal as well. So that'll be something where the graduate faculty will be asked to help both building the package and then selling it to people. And the last piece of this will be to go after a naming gift for the college. So we have been arguing with the university for a while. They think we're worth 10 to 30 million. I think we're worth 50 to 100 million. So we're trying to negotiate getting in that level of donor pool, where then we'll be competing for the top tier donors at UK, as AG just did successfully for the last Gatton donation. So my goal going into the campaign is to get that positioned as an accepted goal, and we'll see if we can get comfortably to a position. I don't want to give away this college's name for a minimal naming gift. So if I can't get that where I think it ought to be, we'll probably sideline that one and build up the other ones more so. But this is where I spend a lot of my time and where we're aimed for the campaign that probably will be starting up formally in about 18 months from now. And that'll be it for that. And I'll stop there. Questions other than just to say it's been a year, I think, for most of us. So I did just really want to encourage you, make space for yourself. If you run yourself into the ground, you're not going to be able to do the work we need you to do. And you're not going to be a smiling, happy participant in our community, which we all value. So this is my daughter and I at the home opener for baseball this year. Whatever your happy spot is, make sure to make some space for it and do that thing. It's important to take care of yourself. So with that, I'll end and take questions, comments, or Rotten Tomatoes if you're not on Zoom.
Well, I'm on Zoom and I put a question into the chat.
So Jurgen's asking about the AACP funding per PI metric being at number 11. So this is a metric I started using the first year I was here to try to get some actual normalization for research revenue within the college. Because if you just look at total revenue, right, UCSF has 126 faculty, we've got 55. Like that's a terrible way to compare the two institutions. So I had mentioned that our total revenue had gone down a little as we've been transitioning in junior faculty. And I think that's probably going to we're probably bottomed out or close to bottomed out this year, probably going to continue for another year or two. And then I'm expecting that to go back up. So this number is down a little bit for us. We're normally like 5 to 7 in colleges. And that's purely just that turnover, Jurgen.
Yeah, but what does it mean per PI is kind of, would that mean divided by all the grants coming in and the PIs of the grants? So it means
grant revenue divided by the total number of research principal investigators.
Oh, okay.
So number of faculty. It's everyone who either puts in applications or has funding.
Okay, all right.
It's a KIPP metric, not a national metric. Any other chat? I know I was not that complete and convincing. Anything people are worried about? Okay. Thank you.